Hello, I am Professor Brady Granger from Duke University School of Nursing. I am the director of the Heart Center Nursing Research Program and serve as core faculty at the Duke Margolis Institute for Health Policy on healthcare transformation. I'm honored to be invited as a speaker at the Global Conference on Person-Centered Care in Gothenburg this May. I have been engaged in person-centered care in the US and also in Sweden for over 2 decades, first serving as a collaborator on the European Cooperation in Science and Technology as part of the Cost Cares Action Package, which focused on the development of a framework for implementation and measurement of person-centered care. Most recently, I've served in the US as co-chair of the American Heart Association Scientific Statement on Person-Centered Care in Cardiovascular Chronic Illness. My focus has been on person-centered care interventions that address chronic illness management and how health systems, clinicians, and communities come together to support patients with healthcare needs. Specifically, I've focused my research on equity and bridging gaps in access to care and supporting communication about care and care needs with the clinical team, the patients, and the community resources. Most recently, I've worked with the Duke Margolis Health Policy Institute to leverage data in advocating for policy change to ensure that financial support for infrastructure and needed community supports for person-centered care are in place. I believe that value-based care, as we commonly refer to it in the United States, is not valuable and cannot be person-centered without a solid financial foundation that supports the culture of the partnership. Partnership not only between patients and clinicians, but also with communities, families, and organizational resources that are existing in the cultural context of the person's everyday life. My presentation at the Global Conference for Person-Centered Care will focus on how we assess and measure value. How do we know when a health system has effectively implemented person-centered care? How are we measuring that? And what indicates value to patients? How do patients participate in the definition, design, and deployment of person-centered, value-based care? I am looking forward to sharing some examples with you of our current patient and community participation in person-centered care implementation as we design the next generation of person-centered care in the US healthcare system. Thank you, and I look forward to a good discussion.